I mean, we're not born to be aggressive, okay? So they may occur in clinical situations. So if you have someone who has a cognitive disorder, okay, like somebody who has Alzheimer's, okay, people who have dementia, again, you think that, you know, they're elderly and they're frail, but actually they can be very aggressive. So an old man with a stick, you know, is not a very sort of... Is that your ringtone? Okay, so when you have a disturbance or sort of a disturbance between impulse and control, okay? So that's one. So someone who can be more impulsive and have less control. So you can have people who have psychiatric problems where they are impulsive, but they're able to have control. But when they drink or do drugs, then their ability to control themselves diminishes. And so you have that balance. Okay. So these are just some of the disorders, for those of you who are interested in psychiatry, where we will see aggressive behavior. Okay. So again, kids with kids or adults with mental retardation, people with ADHD. It's not because they're aggressive, because they're bad. It's just because they're very impulsive. Conduct disordered people. Have you ever heard of conduct disorder?
Like S behavior.
It's what?
Bad behavior.
Okay. It's a bit more than bad behavior. So.
They do something not to the usual.
Okay. So. No, so usually people who have a conduct disorder, kids who have a conduct disorder, they're usually, it's like 4 domains. So they're either going to be like doing things like fire setting, break and entry. They can force other people into sexual activity, so they can, you know, they'll rape people. They're very cruel against animals, so they'll be crushing animals. So that's conduct disorder. So it's just a lot more than just bad behavior, okay? So these people generally can be aggressive and there's no remorse. Okay, do you know what remorse means? Not sympathy, but they don't care. Like, you know, when you do something and you hurt someone, you're going to feel bad, okay? So people who have no remorse, that's usually a very negative indicator of a personality type, okay? And again, delirium, I mean, delirium is a medical condition where people are kind of not oriented, and we see it a lot in the ICU. So you can get called for somebody who's trying to jump out of bed, pulling at their lines, they're completely disoriented, they don't know who they are or where they are. So people like that can be very aggressive. So these are all like warning signs. So if you have a patient, like that's what I usually, like before you go in to see a patient, you look at their file, okay? So when I look at these indicators, then I kind of can sense what am I walking into. You don't ever walk into a dark room, you need to know what you're walking into. Of course, psychotic disorder, so people with schizophrenia or any type of psychotic disorder, it's not that they are aggressive, because sometimes there's the stigma that people with a mental disorder are aggressive and violent, okay? And it's not the case. It depends on, I saw a schizophrenic when I was doing my training, a 50-year-old Russian guy who immigrated to Canada, and his hallucinations were, you know, Tinkerbell, Peter Pan, okay? So that was his hallucinations were like little Tinkerbells, and they're talking to him and they're dancing. So those are very pleasant hallucinations, okay? So this guy didn't want to take his medication because he didn't want to lose Tinkerbell, okay? So again, when you have this working relationship with patients and you can figure out how their delusions or hallucinations are, so that was a pleasant hallucination, okay? Tinkerbell. Okay. So the best predictor of violent act is a previous violent act. So if someone has had a previous history of being violent, they're more likely then to have more violence. Okay. So other predictors, if there's a high degree of intent to harm, if there's actually a victim, so they have an identified victim. Okay. If they've made open threats to that person. Okay. History of loss of control, lack of compassion. Childhood brutality, fire setting, cruelty to animals, and again, enjoyment in watching or inflicting harm. Some people are like that. So some patients, yeah, it's very sick. Okay, they enjoy seeing others in pain. So these are usually personality disorders. Okay. So again, it's a major public health concern. CDC is the Center for Disease Control, all right? In 2000, which was like, you know, a long time ago, 1,400 homicides that involve juvenile offenders, okay? So most of the research is really focused on males, all right? So if you have a childhood onset of conduct disorder, many adverse family risk factors, neurodevelopmental adversities, yani you have some kind of, maybe if you have ADHD or any other type of neurodevelopmental problem, poor adult adjustment. So these are all sort of predictors of more aggression or violence. Okay. Aggression in girls is more common than we thought. We were treating this 13-year-old adolescent here last year where I work. It's a very unusual story. She's not Saudi, okay, but she had a history of aggression towards her parents, but also she would run from the house, so that at night she'd run and they don't know where she is for 3 or 4 days in a row. And then when we interviewed her, so she said, I go out and I hang out with these gangs, and there's a lot of gunshot and drugs, and I'm like, where do we live? Here in Riyadh? What is this, So she pictures something that you would only see like in the Bronx or somewhere in New York, and so she belongs to this gang, and they have sort of organized aggression and violence, and if you look at her, she looks like an angel. You would never imagine that she does so. She steals from her house. She owned a gun, okay, that she just wouldn't bring home. So we thought either she's really lying, it's a huge big lie, or it's really true. But actually, her parents were able to find her at a house, and so it's the very wrong crowd. So again, aggression is, we think, uncommon, but actually becoming more common than we think, okay? See, the beauty of psychiatry is that you always see things that are completely unusual, okay? Very interesting stories about people, okay? So prosocial aggression, where you have male dominance influenced by testosterone. I mean, you would think guys are going to be more aggressive, like in a fight, guys are going to be the ones that will be jumping, but I've seen girls who are very aggressive, they jump in too, okay? So impulsive aggression is related to serotonin, inhibition of synthesis, depletion of stores. Also CSF levels of 5-hydroxyindolamine are inversely related with aggression. So sometimes we can treat aggression with serotonergic medications, okay? It helps moderate the level of serotonin, okay? So these are just sort of anatomical findings. There's never anything that's concrete, so whenever you do an MRI scan of a brain, you'll find parts that are small, parts that are big, but nothing that's ever really conclusive. Okay? So again, things about hormones, whether you have reduced cortisol or testosterone concentration, so these can also be linked to that. Okay? So they say that aggression runs in families. Some environmental factors, things like poverty, low socioeconomic status, harsh parenting, poor supervision. So we already talked about personality development. So if you have sort of a negative environment as well, it can really push you forward towards more negative things. If you have parental psychopathology, so if one of your parents has an antisocial personality disorder, okay, puts you at higher risk. Okay. So the social environmental factors, so things like frustration, okay. So they say that could lead to aggression, direct provocation, and then exposure to televised violence. So if you're seeing violence all the time. Okay. Now again, with frustration, like if you're living in an environment and you're always frustrated, nothing's working out well, would that make you more aggressive, do you think?
Yes.
Yes? Why?
Because it's not working out, you need to take it out of something.
Display, but why wouldn't you be depressed? So it depends. I mean, some people can be more depressed, but I think the displacement is...
Depends if you can control it. Some people can control it.
Usually aggressive.
Usually aggressive.
Okay.
Okay. So if you're living in a place and you're always frustrated, they also talk about environmental. So if you're living in a polluted area and it's always noisy and crowded, and you'll see, I mean, I see people who, if you live in a particular culture, you're more likely to be louder and more aggressive than if you live like in Norway, where everything's quiet and peaceful and people are not aggressive. They're suicidal, but they're not aggressive. Okay. So again, Prevention, we talked about this when we talked about the learning theory, right? So things that you can do to either, help with or help treat aggression, okay? Now, these are things that it's sometimes hard, like if you want to treat someone, help teach someone to be empathic, okay? That's sometimes difficult, so people have a personality problem who don't really care about the world. They get into treatment programs focused on emotional sort of interaction and empathy. So it kind of makes sense, but also is difficult. Like imagine getting like inmates, prisoners, trying to teach them how to be compassionate and kind. It doesn't usually work because their setup or makeup is completely different. Again, we use medications a lot. I'm speaking on behalf, like when we see children who are aggressive. So medication is usually the first, especially if they've got mental retardation or, where you have to control their behavior. I remember once this girl who had severe mental retardation. Okay, so severe mental retardation, and we'll talk about that next week, because there's degrees of mental retardation. So this girl basically was usually tied to a tree. Like they lived out when I was in Jeddah, so they brought her from, I don't know, some city I never heard of it before in my life. But basically they live in a tent and there's a tree and this girl's tied with a rope to the tree because she's blind, she's deaf, and she's severely mentally retarded, okay? So for somebody like that, it's gotta be medications. Because you don't want her to be like, and her grandma, she was brought by her grandma, and I was talking to the grandfather, okay, and the grandma just got on the floor and she slept, okay, because I was talking for like a long time. And then, and she had the rope tied to her foot and to the girl's foot while she slept. Never seen that before. Okay, so medications were helpful for this girl. So, child abuse and neglect, we're just going to run through it. This is like a huge topic. We're not going to get into it, but something you just need to know about, because like an eye-opener, because it's not something, if you don't look for it, you won't see it, okay? We always investigate when we see children, if there's any potential for abuse or neglect, okay? Again, it increases the risk of psychiatric problems, we know that. Children who have been sexually abused have increased frequency of all sorts of problems. Okay? Very simplistic, okay? Abusive parents have been victims of abuse themselves. These are usually parents who've been brought up like being harshly punished. Stressful living conditions can lead to aggression, social isolation, a parent with a mental disorder, and then childhood characteristics of kids who can be commonly sexually or physically abused are children with mental retardation, premature children, those of a physical disability, and they're at higher risk because they're a burden to their caretaker. If you're physically disabled or you're mentally retarded, your caretaker can likely be aggressive towards you as a child. Okay. So there are centers that are sort of set up for the assessment and diagnosis. So where I work, there is a child protection team. Okay. And there's like, when you have an emergency in hospitals, it's a code blue, okay? When we have suspected abuse, it's called a code pink, okay? So code pink is that you suspect that a particular child, so it activates the team, which is a psychiatrist, psychologist, pediatrician, social worker, and they come in and they do an assessment, and the end result of that is usually social services are involved. And we've had children who were removed from their home environment, actually, because of very aggressive circumstances. And they once called me to see this child, not because the child was unwell, but because the mother was extremely unwell. Okay, so it's sort of an indirect. She's going to be somehow abusive. So this was like a 5 or 6 year old child who was in hospital for fever of unknown origin. He was in there to investigate, and she insisted on taking him out. And so her logistics and her explanation were completely off. Okay, it didn't make any sense. In any case, he was discharged against medical advice, and unfortunately he passed away at home because of the fever that he had. So it's a very interesting team that we have, because we will see all sorts of kids who are physically or sometimes again sexually abused. People don't report sexual abuse for so many reasons, as you would imagine.